Good afternoon. Before we start exactly at 2 o'clock, it's now 1:59 Eastern Time. My name is Julie Alvarado, and I will describe the setting that we are here this afternoon, today, Wednesday, September 8th, 2021. On the screen, there are individuals, including myself, Tamara Faust, who serves as co-host, and Dr. Hall and other guests who are participating. You'll see on the screen a blue background with the date of September 8th, 1 p.m. Central Time Zoom event presented on the left side, which says why in parentheses, it says the word and how, close parentheses. We need a healthy mouth to support a healthy body. Caps are the words healthy, in partnership with Causes for Change, Woke Art, and the Disability Equipment Network. On the right, we have presented by John E. Hall, DDS, Doctor of Dentistry. In the midsection of the rectangle box, bordered in blue, we have an African-American family, male figure using a wheelchair surrounded with two children, one standing, one sitting, and what appears to be it's an adult African-American female in the back, standing behind the wheelchair user. That's what we have here, and I'll describe myself briefly. Again, I'm Julie Alvarado. My background is I'm with the palm in the waters, just a background to cover behind my office. I'm wearing I have long dark hair, worn to the side, wearing black glasses, black frame glasses, and just sleeveless dress. And at this point, again, thank you for being present here. We will start and we will invite Dr. Hall to start. And I do invite the participants to please ask questions. You may ask throughout if you hear something or you would like to make a comment for Dr. Hall or statement that intrigues you, that would like to have questions that pop up in the spot for Dr. Hall, please do so. We will make it, yes, it's very informative, but at the same time, this is meant to serve you. Again, thank you, Dr. Hall. Thank you so much for being here with us. Just a little bit of background of Dr. Hall. Dr. Hall is graduated from Baylor College of Dentistry in 1978, and he has worked in Arlington, Texas. He's currently has worked with Carrington Laboratories with Dr. McAnalley, and has seen a lot of clinical trials. And Dr. McAnalley will go more into his background a little bit more so than I have here, but he's co-authored a number of published and co-authored a number of articles in journals and medical and dental journals. And he's currently involved in clinical research and product development. He spends most of his time as an educator. He teaches doctors of the science behind Dr. McAnalley's and the research that he has done throughout on products of dentistry and medicine. And he enjoys talking with us, to the public, and answering and raising curiosity in terms of the products and the research that he has done throughout his life and the experiences that he's had throughout his life in working in dentistry. Dr. Hall, the floor is yours.
Okay, thank you, Zulie. I appreciate it. And again, I want to say, stress that if you have any questions during this presentation or comments, just pipe up. I'd rather do that. I like that instead of necessarily waiting till the end and you may forget, or we have to go back and revisit another slide or something. So I'm really happy to talk to you about why we need a healthy mouth and to support a healthy body. And there's more and more information all the time on that. A lot of research the last 25 years, and then how to do that. So, well, now how do I, we should have made sure that, there we go. Okay, that worked. I have to figure out how to work these slides. Okay, the mouth. There's a picture of the mouth. The mouth's important. Somebody needs to mute, please mute yourself so we don't have the background noise, please. I don't mind so much, but others mind. So I think you did that, so thank you. The mouth's important, and it's important because it's a part of the body, so that's enough. Any part of the body is important. I mean, we can have gangrene of the little toe, and that can be dangerous. So it's important, but it's the major portal to the body, obviously. Whatever we eat, whatever we drink, and a lot of what we breathe and what take in goes through the mouth. And it's not surprising then that it affects the whole body. It shouldn't be, and we know it shouldn't be surprising that what affects the body affects the mouth. In dentistry, we knew this with this, and there were a lot of examples, but the body and diseases and conditions of the body can affect the mouth. And so there are a lot of acute or short-term conditions. Now, I'm I like to have a bunch of pictures on my slides when I can, but this particular presentation, mostly we're talking about kind of some disease conditions. And so I figure most people, I like looking at stuff like that because that's what I do, but most people don't like to look at pictures of disease tissues and organs. So I don't have a lot of pictures, so we'll be talking. So the slides themselves may be boring, but I hope the information isn't. But anyway, mouth sores and ulcers. Most of us get a canker sore every once in a while. A lot of people get herpes labialis, we call it, but it's a fever blister or a cold sore, whichever one you want to call it. It's a viral infection, and it's an infection. So we get viral infections of different parts of the body. When we had measles and chicken pox and all that, well, we'd see that in kids all the time. But still, hand, foot, and mouth diseases out there. 3 of my grandkids had hand, foot, and mouth disease a few years ago, all at the same time. The baby had hand, foot, and mouth, and the 4 and 6-year-old had mouth. They had ulcers in their mouth, very painful. It's a Coxsackie virus. Autoimmune diseases, a lot of diseases out there can cause ulcers in the mouth or sores in the mouth. And a lot of times it happens in the mouth first. So the dentist is the first one to say, hey, you know what? Looks like you're getting ready to come down with something or other. So just be ready in the next few days. You're going to come down with something or other because I already see early signs of it. Medical therapy, and especially cancer therapy, can cause oral mucositis, which is those really bad ulcers that result from chemotherapy or radiation therapy, especially to the head and neck. Oral mucositis, we usually think of side effects. Most people think of nausea, vomiting, and losing their hair, which isn't fun, and there's nothing neat about that. But oral mucositis is the most dangerous common side effect of therapy, of cancer therapy, because it can get so bad. Grade 4 mucositis is life-threatening. Life-threatening tells you something. People can't eat or drink for days. They're already in a not a healthy condition, and then they have to go to the hospital and get IVs and get rescued and all that. So it's a lot of therapy, a lot of and other drugs can do that too, but cancer therapy, and then just the irritations and burns, how hot food or drink. Lots of things can happen to the mouth that are short term. Then there are the chronic or recurring. So some people have chronic. One of my patients in dental school, Nancy was her name, and she's probably in her 40s or 50s. She was old. Back when I was 25, she seemed pretty, but anyway, she had major apathy. She had major big canker sores all throughout her mouth, 24 hours a day, 7 days a week, most of her adult life. And she'd come in about every week or so to the clinic, and there'd be big old sores in different parts of her mouth. She just learned to live with it. Lots of other things that are going on, erosive lichen planus and burning mouth syndrome, lots of conditions that people deal with, that dentists see, that are chronic or recurring, and nothing's really ever worked for those people. Dry mouth is real common. Xerostomia, we call it, dry mouth. Dry mouth is uncomfortable, but it's also unhealthy because we don't have that saliva. So there's more likely to have decay, more likely to have gum disease, infections, ulcers of the mouth, and all that. So lots of things, and there are about 500 drugs that can cause dry mouth. I mean OTC, over-the-counter drugs like decongestants, anxiolytics. Lots of common drugs can cause dry mouth, and people that are on medication like that all the time have constant dry mouth, and that can cause problems in the mouth. And then etc. There's lots of etc. going on out there too. So there's a lot of different conditions going on. So the body can affect the mouth, and things going on with the body, autoimmune diseases, other things can affect the mouth. But now the oral systemic connection I want to move to, and that's been the subject of a lot of research the last 25 years or so. And what it is the health of the mouth affects the body. Well, that's not surprising, but the health of the mouth affects the body in ways we never imagined. And that's what the oral systemic connection is about. I mean, we never imagined the things that we've discovered in the last 20, 25 years. And so because of that, people who know me and heard me speak before, they've heard me say this: the mouth ain't like Vegas, boys and girls. What goes on in the mouth doesn't stay in the mouth. And that's kind of a little chuckle maybe, but it's a serious point I want to make. Keeping that mouth clean and healthy is critical for so many people for good health, and more than just that, it can affect livelihood. So here's a picture, and not a very good picture, but I try to put a picture in when I can. But the point is, the mouth affects lots of, and really just about all the major organ systems, one way or the other, and can worsen disease. So if you have a condition already, and we're talking usually about gum disease, the inflammatory conditions, gingivitis or periodontitis, the destructive form of gum disease, and the bacteria and the fungus and all that cause gum disease can affect these different organs. So if you already have a condition, and we'll talk about different ones, it can make it worse. If you have gum disease, for example, in your mouth, it can make them worse. But now what we're finding that's really been surprising is it looks like, and well, there's lots of data that shows that actually the mouth and the condition of the mouth can contribute to the development of these diseases. We never believed that. We never would have dreamed that. Not shocked that it can make things worse, but now we have lots of evidence that it can actually contribute to the development of these diseases. So that's important to understand. So let's just talk about some of them. And I'm not going to get, this is going to be barely, I don't know if I mean scratch the surface. I may just kind of tap the surface a little bit, but I want to talk just a little bit, and so that you understand what is known out there and what they're working on. Alzheimer's disease, the most common form of dementia. It gets worse as we get older. And a lot of people a good friend of mine died of Alzheimer's about a month ago now. Beautiful lady, and she just got worse and worse and died of Alzheimer's. It's not a fun disease to have, as we know. It's always been considered that it was due to certain plaque formation of certain proteins called amyloid in the brain, and amyloid beta. So amyloid is a protein in the brain, and then amyloid beta has been considered a misfolded protein. It's an amyloid that's shaped wrong, and that it gets sticky. They form amyloid plaques. You get these amyloid plaques all in the brain, and that causes Alzheimer's. Well, the problem with that, and that's still the most common thing. If you go to the internet right now and look that up, you're probably going to see amyloid. The problem with that is they've developed, well, number one, there are lots and lots of people who have amyloid plaques all through their brains, and they have not any dementia whatsoever. That doesn't make sense. The other thing is they've developed vaccines, they've developed drugs that target amyloid plaques, and nothing's ever touched it. Well, that doesn't make sense. So what's happened now, one of the things that's happened, they've found that bacteria that belong in the mouth that cause gum disease. There are certain species of bacteria that should only be found in the mouth in tiny numbers. But if we don't keep that mouth clean and we allow these bacterial populations to grow, they can cause gingivitis, the mild form of gum disease. You might have a little bleeding with you brush your teeth. Then it goes to periodontitis, which is the destructive form of gum disease, where the soft tissue and the bone are being destroyed, and there's bleeding, and these bacteria get into the bloodstream, go to different parts of the body. They have found these bacteria in the brains and the plaques of Alzheimer's patients. And they've also found some of the chemicals that they secrete in the brains of these patients. So now one of the theories is the infectious theory. They think maybe that what's causing Alzheimer's is it's an infection. And it's not only these bacteria, but one of the main ones is these bacteria that should only be found in the mouth that cause gum disease. They get into the brain, they set up, and the body then, and now they're about to decide that amyloid is actually the part of the immune response. Amyloid beta is the immune response designed to kill the bacteria. So if that's true, then we've developed vaccines and drugs that are working against the immune response. But
Dr. Paul, excuse me for interrupting. How do you spell the word? I want to put it on the chat, so in case people, the amyloid, here's the spelling of that, so.
amyloid, okay, Amyloid. It's AMI, so Amyloid,
Okay.
and that's the protein. And then the abnormal protein they call amyloid beta. So you just put the the Greek letter beta or write beta out, and then that's misfolded. Proteins are folded. For them to function, they are folded, but this is misfolded, or at least they feel like it's misfolded. But they get sticky and then they form plaques, and they stick together and form plaques. So amyloid. But anyway, there's a lot of evidence. We know that sets up neuroinflammation. One of the things you're going to hear over and over again is the word inflammation. You get inflammation of the brain. Chronic inflammation is destructive. Just understand that. Short-term inflammation is good. It's part of the immune response. We get an infection. We have a wound that the immune system controls the healing of wounds. Also, a lot of people don't do that. But inflammation for 24 hours or so is really good to help kill bacteria or fungus, viruses, also with the wound healing process. But when you have chronic, long-standing inflammation, it's destructive, and it does lots of bad stuff. And so chronic inflammation is what we're talking. So we get chronic inflammation in the brain, that's destructive. These bacteria also secreting enzymes that break down part of the brain. And so there's a lot of evidence that shows that these bacteria are involved for sure in the progression of Alzheimer's. If you already have Alzheimer's, it makes it worse. But now there's a lot of evidence that shows that they probably contribute. And it's not the only thing, but they play a part in the development of Alzheimer's. There's a lot of evidence to support that. Some more evidence that kind of helps out Alzheimer's patients that have gum disease. If that gum disease is untreated, the Alzheimer's progresses. But they've done enough studies that show if you treat the gum disease, even if it's just cleaning the teeth and getting some of that out of there, or you have surgery and you get some of that disease out of the mouth, they've had improved memory. So they've actually reversed a little bit of it. It's not curing it, but when you see that, that tells you something. So it's really obvious that the bacteria that are in the mouth play a role somehow in the progression and probably in the development of Alzheimer's disease. So that's important to understand, because Alzheimer's, after the age of 65, about every 5 years, the number doubles of people that are going to get Alzheimer's. So between 65 and 70, so it's significant. So they're not doing as good a job cleaning their teeth. Things of the immune system's not working as well. Okay, cancers. And again, I'm just going to touch the surface of these cancers. Or there's a lot of evidence that oral bacteria are involved in a lot of cancers. We've known they're involved in oral and mouth cancer and esophageal cancer. Now we know there's a lot of evidence they're involved in pancreatic cancer, colorectal cancer, lung cancer, and others. And there are specific bacteria. And again, these are the bacteria that are involved in developing gum disease. And these are bacteria that belong only in the mouth. They shouldn't be found anywhere else in the body. But you have gum disease, you have the destruction. These bacteria get into the bloodstream. They go to different parts of the body. Or they're in the mouth, but they're secreting chemicals that get into the bloodstream. There's these species, and especially one species that's been involved in gum disease, we know it can produce carcinogens, which are chemicals that can cause the development of cancers. So there's one species, let me just talk about this real quick. They've got enough evidence, they've already seen this. There's one species that only belongs in the mouth that causes gum disease. It contributes to the development of tumors, of cancers. While it's doing that, it affects pathways involved in the immune response. It contributes to the immune system actually destroying some of the immune cells, our T lymphocytes that are involved in recognizing cancer cells. While it's doing that, it's actually preventing the immune system from killing the cancer cells. I mean, this is it's real nefarious and nasty and mean, and it's really got it out for us. So it's causing tumors to develop. It's killing some of the immune cells while it's preventing the cancer cells from being killed. And then on top of that, it actually promotes the metastasis or the spread of the cancer. they've already got that evidence. They already know that. So is that the only thing going on? No, but it's one thing that we know that's going on. And again, I'm going to say this over and over again. It's happening from the mouth. So we can get to the mouth relatively easily. It's a matter of keeping that mouth clean, getting the disease out of the mouth and keeping it clean. But you see, in my family, we have cancer. We don't have cardiovascular disease. Everybody in my family dies of cancer. So this is something that I take personally. Okay, cardiovascular disease. And I'm really rushing through these, but cardiovascular disease, and basically we're talking about heart attack and stroke. There's deep vein thrombosis. There are some other things, but basically we're talking, in this case, we're talking heart attack and stroke. And again, there's a lot of data that's come out where these same bacterial species that cause gum disease, they found these in the plaques. They've done studies. They found them in the atheromatous plaques of heart attack patients. So those plaques, they talk about cholesterol that are involved in forming these plaques that get into the blood, into the arteries and block. And so when you talk about blockage, they do it and you 95% block, where they're talking about these plaques. They're finding these bacteria that should only be in the mouth. They're finding them in the plaques of heart attack patients. They've already had a heart attack. They have found them in the thrombi, or clot, if you want to call it, clot of stroke patients. About 86, 87% of stroke patients are ischemic stroke patients, and it's due to the development of clots that block the blood flow to the brain. The rest of them are hemorrhagic, where they bleed out. That's about 13% or so. So they're finding these bacteria in the clots of these stroke patients. And then again, inflammation. Always, when we talk about all these, the chronic inflammation that is being caused by these bacteria, and just the inflammation of the gum disease. When you have gum disease in the mouth, it's an inflammatory condition, and there are things, when we have chronic inflammation, chemicals are being pumped into the bloodstream for anywhere in the body. If you've got rheumatoid arthritis, it's being pumped in from your joints or whatever. In the mouth, and these chemicals are getting in the bloodstream, going to all parts of the body. They're destructive. They cause all kinds of problems. They can cause cancer. They can contribute to the development of a heart attack. In fact, I saw one study where they said basically, if there's no inflammation, you don't have a heart attack. It's like it's the last domino that falls before you have a heart attack. And so when you have this going on in the mouth, and then the bacteria get into the bloodstream, go to the parts of the body and cause systemic chronic inflammation, then that is basically the last thing before a heart attack or a stroke. So lots of evidence for that. Again, I've got more information on that, but I don't want to get on that right now. Just understand they've got a lot of evidence for that, and keeping that mouth clean and healthy is important when it comes to cardiovascular disease. Diabetes mellitus. Type 1 is insulin dependent. The vast majority who have it have type 2, which is not necessarily non-insulin dependent, but they may be able to take some other drugs. But and that's usually due to lifestyle. We're overweight, we're not eating the right foods, we're not taking care of ourselves. Well, the thing is, people who have gum disease, periodontitis, and I put periodontitis because I forgot. Periodontitis is the destructive form of gum disease. So I try to say gum disease when I'm talking to the lay public, but when you see perio or periodontitis, we're talking about the destructive form of gum disease, which is really the big player in all of these. If you have diabetes already and you have gum disease, that makes the diabetes worse, because diabetes, there's an inflammatory component in all that too, but it makes the diabetes worse. What we didn't know, but we now know, is that gum disease is considered a major risk factor for the development of diabetes. In fact, there are researchers out there that say that diabetes is the greatest complication of gum disease. I mean, they just tie it together. It's already been called a two-way street and an association. So if you have gum disease and you're overweight and you especially have diabetes in your family and you're not taking care, you have a much greater risk of developing diabetes. So getting that gum disease under control is important. Non-surgical perio treatment or gum treatment has been shown to lower blood glucose. Non-surgical, what does that mean? It means having your teeth cleaned. Having your teeth cleaned if you have diabetes and your teeth really need to be cleaned, that's been shown over and over again to lower blood glucose and even hemoglobin A1C to some extent. So that's more evidence to show that they are tied together. So keeping that mouth clean and healthy. Rheumatoid and diabetes affects everything. Diabetes, it affects every cell of the body because every cell of the body needs glucose. And so it's not surprising when you have diabetes, everything's affected. And so that's important to understand. It's the leading cause of blindness, basically. It's the leading cause of kidney disease and kidney failure in adults usually. And it's bad. And so diabetes is something that we need to get under control. And if you have diabetes, get that mouth clean and healthy, get it healthy. If there's disease, get it taken care of. If you have a family history of it, do what you need to do. Start living a more healthy lifestyle, but get that mouth clean and healthy. Okay, rheumatoid arthritis. And of course, we think the joints and it affects the joints, but rheumatoid arthritis affects in so many cases, about 40% of patients have rheumatoid arthritis. They have other organs involved. That involves the lungs, the heart, the kidneys, the eyes, all kinds of the skin, all kinds of things. So rheumatoid arthritis, and again, it's because it's a chronic inflammatory condition. ITIS means inflammation. I think most people know that. Maybe you don't. If you didn't know that, when you see ITIS, that means inflammation. So arthritis is inflammation of the joints. Appendicitis, inflammation. Usually there's an infectious component to these diseases too. Appendicitis, tonsillitis, bronchitis, in this case, periodontitis. So we're all talking inflammation. So when you have an inflammatory condition like this, and then you have inflammation in the mouth, that's just adding insult to injury. So if you have rheumatoid arthritis and you have destructive gum disease, your arthritis is going to progress even faster than it normally would. Gum disease is now understood to be you're going to have significant increase in bone and cartilage destruction. It's going to make things worse. And again, as we said before in other conditions, when you have perio treatment, whether it's gum surgery or just having your teeth cleaned, they see improvement in disease parameters. The inflammation, the erythrocyte sedimentation rate, the C-reactive proteins, that those things get better, go down, their function, they do better. When you get those perio treatment, your function is better. And it's just tied in. There's just no getting around it. So that's rheumatoid arthritis, and that's a lot of people, millions of people. Okay, pregnancy outcomes. Pregnancy is not a disease, but it's a condition. Just ask any mom, and there's a lot of that going on out there too, by the way. So it's important. What we know about in pregnancy, it is one of those that affects the mouth, those hormonal changes. Boy, I mean, a lady comes in pregnant. I mean, you can't hide that from a dentist, even though she may not even know yet. But boy, that dentist has a pretty good idea this lady's pregnant because you see things happening in the mouth. But now we know that the health of the mouth, can affect pregnancy outcomes. And again, gum disease and inflammation have been tied into premature and low birth weight. Preemies and low birth obviously go together, but premature babies aren't ready to be born. Their lungs aren't ready, their livers aren't ready. Low birth weight is basically defined as below 5.5 pounds. So even if it's a full-term baby and it's less than 5.5 pounds, it's much more likely to have issues now and as they're growing, but they're more likely to have infections. They're more likely to have autism, more like all kinds of issues. They're more likely that they're going to have slower development, social development, all kinds of things. So gum disease and inflammation of gum disease has been shown to be tied in to increase in premature birth and low birth weight. Preeclampsia, which is pretty, relatively common. That's moms who are pregnant that have high blood pressure and protein in the urine. That's not a good situation. It can lead to eclampsia, which is preeclampsia with seizures, and that can be fatal, obviously, for mom and for baby. PPROM is just premature rupture of the amniotic membrane, which leads to premature birth and can cause all kinds of problems. Gum disease has been tied in to both of those conditions. And then intrauterine infections, which is the leading cause of stillborn, and babies, and you know, just it's a serious condition, serious problem. Obviously, we now know that a lot of these, the bacteria that causes that actually starts in the mouth, goes in the bloodstream, and goes to the uterus, and can cause that. So one of the things that they now are doing, obstetricians, if the obstetrician isn't, he or she should, but they are now being instructed, you got to teach your patients that they tell their patients that they've got to have a healthy mouth. They need to go to the dentist and make sure everything's healthy. So one of the things they're instructed, besides taking vitamins and all this other stuff, and don't drink alcohol and all that, be sure your mouth is clean and healthy. It's important. And then I want to finish up on this with pulmonary or lung diseases. And then there's another slide I'll talk about, but oral pathogens, bacteria, fungus, can be inhaled from the mouth into the lungs. And that can cause, you know, aspiration pneumonia, and obviously that's not surprising. It's just real easy to accidentally inhale something into the lungs instead of swallow it. That happens more likely as we get older, and some older people have problems with swallowing, or if they're intubated, that's a real problem. But also they can get into the bloodstream, like we've always talked about, and go to the lungs and cause problems, and again set up chronic inflammation. So if people have COPD, chronic obstructive pulmonary disease, which is emphysema or chronic bronchitis, and again bronchitis and inflammation, asthma, all of these are inflammatory conditions. So you add inflammation to inflammation, things get worse. And we now know that these bacteria from the mouth can also contribute to the development of lung cancer. So pulmonary diseases, keeping the mouth clean and healthy is important, and that tends to be generally for people who are older or people who have these conditions. A lot of kids have asthma, so it's important for them to keep their mouth clean and healthy. Now, here's some new information that just came out last week in the Journal of American Medical Association. And it probably is going to be controversial just because of the politics of all this nonsense going on. But the SARS-CoV-2 virus, the COVID-19 virus, they've always assumed that it was entered the lungs through the airway. It gets into the nasal passage, gets into the mouth, whatever. Then we inhale it, gets into the lungs, and it sets up all these problems, just like so many other things that we see with pneumonia, a lot of the flu and all that kind of stuff. The thing is, though, now they've had enough time. They've done a lot of pulmonary radiological, so doing a lot of X-rays and imaging of the lungs. Also doing autopsies of people who have died of COVID, and what they're finding, they're not seeing the pathology. They're not seeing the inflammation and the pathology of the airways, the alveoli, the bronchioles. They're not seeing that like they should, like they would if it was due to being inhaled. What they're seeing is they're seeing inflammation and pathology of the endothelial cells of the vessels in the lungs. So that tells us that it's entering the lungs through the bloodstream, not through the airways. They didn't talk about wearing masks in this article, by the way, but it does kind of beg the question, doesn't it? But anyway, and I'm not anti-mask, but let me just stop right here and say this. Masks are fine. They're fine, but the problem that I've had with it is they've majored in minors. Wearing masks is okay if you want to wear a mask. But they used to say a year ago, be sure and wear a mask and wash your hands really well. They don't talk about washing your hands really much anymore. Like with the flu, every year with the flu, they have never told people to wear a mask. They've always told you, wash your hands. Wash your hands, keep your hands clean, wash your hands, wash your hands, wash your hands. They haven't been doing that. Now this new data is telling you, what's it telling us? It's telling us you got to have your hand, you got to wash your hands, keep your hands clean. Because what they're finding is, we know that COVID-19 virus is in the saliva and it's in the plaque, the bacterial colonies that are on the teeth that cause tooth decay, that cause gum disease. These serve as reservoirs for the virus. So what does it look like is happening? The same thing I've been talking about all this. You have destructive gum disease, even just gingivitis, a little inflammation. The virus gets into the bloodstream from the mouth, and it gets into the bloodstream, and it goes through the heart to the lungs. That's what they're seeing right now. That's all the evidence is pointing to that. So Masks are fine, but I just want to emphasize, I'm not de-emphasizing masks, but I wash those doggone hands. I don't know if I have that. Let me tell you what I do. I've done this for 15 years probably, but I carry that around. Let me see if you can see that. I carry this around. If I can't wash my hands, I use my hand cleanser all through the day. I have long time before COVID, just because tuberculosis is out there and all that. And I'm getting old, and my immune system's getting old. So anyway, while we're at it, let's be real practical. And I want to stress washing your hands, because now that looks like that's the main thing. So they're talking about oral hygiene. In this article, he said, boy, we need to really stress oral hygiene, because that looks as they're talking about flossing, brushing, and mouth rinses. They emphasize mouth rinses, which I'll talk a little bit more later. So brand new information. That's something that you probably don't know. So when we're talking about the oral systemic connection, I guess we're doing okay on time, right, Julie?
Yes, yes, we are. And I'm glad you asked it, because I was going to ask you
I'm-
that question. I was going to ask you that question. I'm glad you're touching it about, you kept saying about in terms of, keeping your mouth clean.
Yeah.
It's like I was going to ask you just brushing the teeth with toothpaste, but you did mention flossing. Some individuals are not able to floss. What other technologies are available for that?
I'm heading there. I'm heading there, Julie. I'm
Okay.
heading in that direction. So anyway, to sum it up, and I really haven't done justice to this, but there are three basic mechanisms when we're talking about the oral systemic or mouth-body connection. The bacteria that belong in the mouth, they can get into the bloodstream or into the lungs in one case, but they get into the bloodstream because of the breakdown of the tissues and gum disease, and then go all over the body. And then they can secrete chemicals that get into the bloodstream and cause all kinds of problems. The other thing, and I didn't really talk too much about the GI tract. Those who know me well, I always emphasize the intestines. But one of the things that happens is these bacteria also swallowed. They're large. They should be in the mouth in small numbers, but we allow them to get into huge numbers, populations. They're swallowed. They make it through the stomach. They get into the intestines. They mess up the intestines. The bacterial populations, we know about probiotic and all that. The bacterial populations are critical to good health. 70 to 80% of the immune system is in the GI tract, in the intestines. And the bacterial populations are critical to the proper development and proper function of the immune system. These bacteria are swallowed. They can also get to the GI tract through the bloodstream too, but they also are swallowed, they change the populations. They call it dysbiosis. They cause a problem and alter the populations. And then the first thing that happens, the immune system starts acting funky, and it sets up chronic inflammation from the GI tract. So that's something to be aware of. So chronic inflammation, as I've said over and over again, is destructive. So it can be the inflammation from the mouth that's already there from the gum disease, but it also can be, and I use the word target, that's not really the accurate, but it can get into the bloodstream, go to the liver, go to the pancreas, go to the lungs or wherever, and set up chronic, because the immune system is going to try to fight the bacteria there too, or in the brain, and cause the neuroinflammation. So you can get inflammation there in that organ too. And then the GI, as I just mentioned, the GI dysbiosis, or it can get into the intestines and cause an alteration in the populations of the bacteria in the gut, in the intestine, that are critical to good health. So that's what can happen. The point is, it's starting in the mouth. So if your mouth isn't healthy, you're not healthy. So the mouth is critical. More and more, we're understanding that all the time. So when I practice, and I haven't practiced dentistry in 35 years, I've been in research and all that. So, but back in my day, we were taught, don't tell your patients to use mouthwashes. They just floss and brush. That's all they need to do. Well, finally, at long last, the American Dental Association has finally, thrown up their hands and said, now they recommend mouth rinse for part of the daily oral hygiene regimen, because the reality is people don't floss and they don't do a good job brushing. The other thing is some people, they have crowded teeth and all that, they can't, or they have they have conditions going on. They can't, they have rheumatoid arthritis, or they have disabilities and they can't do a good job of flossing and brushing. And that's where a mouth rinse can really make a difference. And so I'm big on mouth rinses. And so the problem is there are problems with the current mouth rinse. There's a prescription antimicrobial rinse that is considered the gold standard. It's been out there for about 35 years or so. And it's pretty good. It does a pretty good job of controlling these bacteria that we're talking about. It's toxic. It can cause permanent alteration in the sense of taste. You sure don't want to swallow it. It has other side effects. It can cause ulcers of the mouth. It can do all kinds of things. And it inhibits the healing process. I'm big on healing. We almost all, somewhere in our mouth, we have, even if it's microscopic, we have places that need to heal. And especially when we're talking about a virus, it's as tiny as a virus, we need everything healed up, and we need those tissues to be as healthy as we can. These things inhibit the healing process. If you have an ulcer in the mouth, they slow the healing process down. The prescription antimicrobial rinse. You can go to the store and buy an OTC, just an over-the-counter mouthwash, and whatever your favorite brand, if you have one. They're not that good they're better than nothing, but they're not that good at controlling these bacteria we're talking about, and especially the fungus. They're also toxic. We're not supposed to swallow them. We're not supposed to swallow that prescription. We're not supposed to swallow toothpaste, because if you swallow too much, it can make you sick or worse. They're just inherent toxicity, and the mouthwashes inhibit healing too. So one of the reasons that Dr. Bill hired me a long time ago is he wanted to develop some products for the mouth, and he thought having a dentist who knew something about the mouth would be a good idea. So that's one of the things we want to do. So now I'm going to talk about what we did to answer this. And so we have a product that we call TheraGel. And I guess I'm advertising a little bit, but let me tell you, there's been a lot of research and a lot of reason that we developed this. It's FDA approved as an oral coating rinse. It does three things that no other single product in the world does. It provides excellent pain relief without numbing the mouth. Better pain relief than you can get from a narcotic or something. If you have an ulcer in the mouth, it's going to give you great pain relief. It protects from contamination. Studies have shown it's superior to the gold standard antimicrobial rinse. It's a prescription, and it promotes optimal healing. Everything remember I told you on those mouthwashes, it's going to slow, and the mouth rinse is going to slow the healing process down. This speeds the healing process up, and wounds heal faster, and they heal stronger with this product too, studies have shown. So no, everything else we do in medicine and dentistry, when we treat wounds, whether it's in the mouth or out, we're slowing the healing process down almost always. This speeds it up. So that makes it really unique. That's one of the reasons I spend my time talking to doctors, to MDs, to dentists, whoever, because there's nothing else like these products. And so you have to explain. So I explain the physiology and all that and how it works. The other thing that's really, one of the other things great, besides the fact that it does things that nothing else does, it's safe. TheraGel is mostly water to which has been added 100% all natural plant-based food ingredients. So it's food, and it's plant-based food. There's no drugs, there's no synthetic or man-made molecules, no animal product. It's plant-based food. So it's all natural, it's drug-free, and it's non-toxic. It's made to be swallowed. It's a swish. In dentistry, we call it swish and swill. You can call it swish and swallow. Most products are called swish and spit, just like the mouthwashes. We spit them out. This is made to be swallowed. A lot of ulcers in the throat, that ulcers from chemotherapy, radiotherapy, they have ulcers in the throat. Everything else, they have to spit it out. This they can swallow and take care of it. But this is food. It's good for you to swallow. And that's hard to get people to think about. But it's nice to have something that is absolutely safe to swallow, because, see, non-toxic, that's an absolute statement. Oh, you can't say that. Yeah. It's non-toxic. There's no toxicity. Food, by definition, is non-toxic. God gave us food to eat, not poison. Food is non-toxic, and that's what makes it unique. It's been equal or superior to the gold standard. I just mentioned that as an antimicrobial rinse without the side effects. And so it's the safest. It's the safest by far. I don't care if you can give it to a baby who's 1 day old. It's safe. You can give it to somebody who's 250 years old if you can find him or her. It's safe. and it's effective. It's the safest and most effective rinse to help keep the mouth comfortable, clean, and healthy. And as I've been talking about, that's really important. So a clean, healthy mouth is vital to overall health. And so if you can floss and brush, you want to do that, and you want to incorporate mouth rinse too. You want, and to me, you want our product. It's not expensive. It's not cheap, but it's not expensive, but it works really, really well, and it's safe and effective, and it does better than the others, and it's safer. And for people who have problems with flossing and brushing, man, it's really important to incorporate something like that. So that's my presentation, Zuli, and I appreciate the opportunity, and I really appreciate our partners, the Causes for Change and Vocard and Disability Equipment Network for being partners in this. And the other thing I want people to know, if people are interested in learning, there was a picture of some Yahoo. I'm not sure where that came from. It must be my twin brother. Looked like my twin brother. Anyway, if you want to learn more information about Theragel, you go to theragel.org. It's real simple. Theragel, T-H-E-R-A, like therapeutics or therapy, and then gel.org. Or if you'd rather just get information by way of email, it goes info@theragel.org. So you can get all the information you need pretty much with that. So it's a great product. It's safe. It's effective. I'm proud of it. I'm proud to be a co-developer of it, and you know, it's important. But it's regardless, it's important. It's vital to keep that mouth clean and healthy for everybody.
Thank you so much, Dr. Hall. Yes, I just wanted to share with you as well, because I remember the first time that I contacted you was because through Causes for Change, I had received an ask or an emergency kind of situation that of a call of a child who was going through needed surgery, and had because of cleft lip and cleft palate. Right. And in order to get the child, she was very malnourished, and fortunately we were able to schedule the surgery for the cleft lip. And we were very concerned because of her situation, the severity of the cleft lip and cleft palate. We were concerned about infection and healing, and especially for a girl, whether it's a girl or boy or any kind of situation it may be, we're always concerned about how we look and appearance. And of course, sure, being a female, we were just concerned if she were to grow up, what will become in terms of her facial appearance. And so I contacted you. I learned, that's how I learned about you and Theragel, and I thought it's like, let's try it, because I was concerned and just wanted to let you know. And I just really expressed my appreciation, because the other child did go through surgery. The healing process was very fast. There was no infection. It went really well. And so just like that kind of situation that I just wanted to say, but there's so many children, and I know particularly my interest because of Causes for Change and my work with Vocard and the Disability Equipment Network. We want to make sure that new products that come into the marketplace, new tools, technologies, we want the community of disability and the aging population in particular to really learn what's out there. Many of us have difficulties getting out or learning or limited types of information that's available to us. And so I'm really pleased that we have this before us. Because again, you mentioned in your presentation that children, like I said, and I mentioned to you as well, that developmental disabilities, children with autism who may not be able to follow instructions, or even arthritis, the elderly, to floss or to brush becomes very challenging. Right. So to have something like Theragel to be able to rinse and know that with swish and swallow and keep it there, that bacteria that could be detrimental to someone's body, someone's health, could be quickly eradicated and prevent kind of more infections and damage to the body. Maybe you would like to say a little bit more about that. I've said enough.
Well, the thing is and I'm real big on the wound healing. With as far as our product, what people love is the pain relief. I mean, and when you're in pain, we all want pain relief, so they love that. I'm real big on the wound healing. I'm big on and when we're talking about the oral systemic connection, we're talking about the second pro, protecting from contamination, but we're also talking about wound healing. Boy, the faster you get a wound healed, the faster you're addressing pain, but the faster you're addressing potential infection. And so, and like I said, it doesn't have to be a big wound. Almost all of us, I guarantee you, almost everybody has what I call micro abrasions. The mouth's busy. I mean, we're eating chips, we're eating food and stuff, and they're just tiny little areas in the mouth that that need to heal. And getting that healing done is really important. And then when we look at this data about the SARS-CoV-2 virus and all that, so that's important. So I'm big on the pain relief, because that's what people love. And when I have a sore or something, I love that. But boy, that protecting from contamination and healing are really important. And again, no other single product does that. Almost everything we use in medicine and dentistry, the wound cleansers, the topical antibiotics, the topical anesthetics, even the preservatives in products, they are so toxic to the cells of wound healing. It's a lot easier to kill the cells of wound healing than it is to kill the bacteria. And studies shown killing 10 to 100 cells of wound healing for every bacterial cell. We're not doing that with this product. That was something we were cognizant of, and we're actually stimulating the healing process. So instead of slowing healing down like we do with just about everything else, it speeds it up. And that's huge when we're talking about all this. The protecting from contamination is obviously paramount, but that wound healing is important, and for everybody. So everybody, to me, everybody needs Theragel at one time or another. And really, when you're talking about all these different conditions, we're talking about millions and millions of people. Almost everybody really needs it every day, as far as I'm concerned, for ideal, optimal health. And that's what, to me, that's what we're all about. That's what our company is about, is optimal health.
Thank you. You mentioned also that this could be, it doesn't matter just the age, including babies, especially because if they're teething, I imagine, because they can't express pain other than cries and severe and louder and louder. So I can imagine that for babies, when they're teething, probably it doesn't matter the amount of how much Theragel, because you mentioned it is food.
Fine. No, it's safe. And of course, for teething babies, you're not going to use that much anyway, but it's safe for teething babies. And it works in a few minutes. They're going to get pain relief. I've heard that for years and years. It just works beautifully for teething babies. I've mentioned that 3 of my grandkids had hand, foot, and mouth. I was in California, and it was a few years ago. I was in California doing some presentations, and my son called me and said, "Man, they've all 3 got hand, foot, and mouth." Well, the baby had hand, foot, and mouth. The 4-year-old and the 6-year-old had mouth. They had ulcers, just crying and all that, and just couldn't go to sleep. They were miserable because they're very painful. And he said, put Theragel in there. You had to swab the younger ones because they're not going to swish and all that. And he said in 5 minutes they're asleep. And about 4 hours later they wake up and it's gone. By then it's washed away. It's gone. It's been swallowed. It's food. The body knows what to do with it, but it's gone. They woke up. They were crying. He put some more in, and they were comfortable again for a few hours. But it's safe. It's safe to use for babies. It's safe to use for kids. It's safe to use for old people, even older than I am.
Great. Thank you, Dr. Hall. Would anyone from our listening audience have any questions, comments for Dr. Hall?
Zuli, Dr. Hall, yes. This is Tamara Fouts. I found that really an amazing talk, and it perked my ears in areas I hadn't thought of before as well. I actually was caregiver for my mother, who passed when she was 96. But she was getting dementia earlier in her probably mid to late 60s and on. But one of the things we got her those last 4 years she was under our roof was this product, and she had dentures though. So I wondered, without teeth, even that mouth disease is an issue. So it was a little hard to get her to swish, but what I did is I quit using that cleaning, they have whatever it is you clean their dentures in, I would use the Theragel with some water and then, get that in her mouth that way. And her quality of life though was really good. And her dementia just never seemed to get much worse, but even with dentures.
Well, the thing is dentures are notorious. I mean, they're really porous. And so they're notorious for getting filthy, and the vast majority of people that wear dentures, the dentures get really nasty. And so it's built the same thing as with teeth. You need to get them clean, but you need to keep them clean and keep those dentures clean too. And so, but they're harboring all that stuff. So they just serve as their false teeth, but they kind of serve like teeth as far as the plaque growing on it and those bacterial populations growing. So even if you don't have teeth, if you have dentures, now if you don't have anything at all, it's still important, but it's not as hard to keep the mouth clean when you don't have any teeth because they don't have that many hiding places. But when you got those dentures, you're going to have they've got to be kept clean, and especially for these people, they've got to. And so many of these people are going to be wearing dentures. So even if they don't have any teeth, that this can really make a huge difference in keeping that. Get those dentures cleaned, and then keep them clean. And this can help keep them clean too.
So you would say the same thing, I'm assuming, for teens or anyone who wears braces.
Absolutely, absolutely. That they're for lots of other reasons too. I mean, they can really have their teeth can actually get decay real easily, but it affects the health of their mouth. So, and certainly there's discomfort. So it's really great for orthodontics too, for braces.
Thank you so much. Wow, so much information. I know that the amount of time that we've had here is limited, and that we could just go just on one particular thing for a very, very long time, particular illness. Again, thank you so much, Dr. Hall, for being with us here today. I want to invite anyone who would like to try Theragel. I really encourage you to. As for the same reasons that Dr. Hall mentioned, and in terms of Tamara Fouts and myself, it's really a tremendous product for healing wounds. Theragel.org. That's the website, and you can also order there. You can trial size. See if something that would work for you. And then if any kind of questions that you may have, you may also write to info@theragel.org. Again, thank you for your support to Causes for Change International. We work to impact communities in the areas of health, education, and training that lead to economic self-sufficiency here in the Americas. Also for Vogue Art, the Volunteer Office of Community Research for Disability, accessibility and resource and training for serving the Northwest Indiana region, and the Disability Equipment Network, again, that services people with disabilities and the aging in the Northwest Indiana region, and particularly with a focus in this in providing services to the Miller Beach community and the city of Gary. Thank you so much for your support. In this recording, I will pause at this time. And